Environmental health is one of the core pillars of community and public health nursing. This focuses on how our surroundings, both natural and man made, affect human health and well being. When we say environmental health, we refer to the physical, chemical, and biological factors external to a person that can influence health outcomes. These include the air we breathe, the water we drink, the waste we manage, and even the communities we live in. Its main goal is disease prevention. That is, creating environments that are clean, safe, and supportive of good health. Remember, prevention always starts in the environment. When we eliminate hazards and ensure safe living conditions, we prevent illnesses even before they occur. And lastly, environmental health serves as a key public health pillar, ensuring that our communities have safe water, clean air, efficient waste management systems, and smoke free spaces. These are all essentials for achieving optimal health in every community. Now, let us talk about why environmental health matters so much. First, poor sanitation and pollution are major contributors to both infectious and chronic diseases. For instance, unclean water can lead to diarrheal outbreaks, while long term exposure to polluted air contributes to cardiovascular and respiratory illnesses. Second, environmental hazards such as unsafe waste disposal, contaminated water, and air pollution lead to diarrheal diseases, respiratory illness, and vector borne infections like dengue and malaria. Finally, as nurses, we hold a crucial role in environmental protection. Our nursing responsibilities include identifying environmental risks, educating communities on prevention, and advocating for safe and healthy environments. When a nurse promotes proper sanitation or supports a smoke free barangay ordinance, that is environmental health in action. There are four major programs that operationalize environmental health in the Philippines. We have the Water, Sanitation, and Hygiene, or the WASH program, which focuses on clean water and safe sanitation. Another one is the Solid Waste Management program. This addresses waste reduction, segregation, and recycling. Then we have the Clean Air Program, which combats air pollution and promotes clean energy. And there is the Tobacco Control Program, which prevents smoking related illnesses and promotes tobacco free environments. Each of these programs targets a specific environmental determinant of health, whether it is water, waste, air, or lifestyle, and these determinants collectively form a framework for a healthier community. WASH program stands for Water, Sanitation, and Hygiene Program. It is one of the most fundamental health programs implemented by the Department of Health in coordination with the DILG, DepEd, and the local government units. The goal of the WASH program is universal access to safe water, sanitary toilets, and good hygiene practices. Access to clean water is a basic human right and the first line of defense against waterborne diseases. This program also emphasizes disease prevention by reducing water and sanitation related illnesses such as diarrhea, cholera, and typhoid. It also promotes coordination and collaboration among multiple sectors, the health, education, and infrastructure sectors, because improving sanitation is not just the nurse's job or the healthcare team's job. It is everyone's responsibility. The WASH program has three major strategies. First is the safe water and sanitation. We ensure that families and schools have access to clean drinking water and hygienic toilet facilities. Barangays often do this through deep wells, water refilling station, and sanitation projects. Second is hygiene education. This is promoting regular hand washing and hygiene instruction in schools and communities, which drastically reduce disease transmission, especially among children. And another strategy is community empowerment. Sustainable sanitation happens when the community owns the program. When BHWs and families lead local projects like toilet building or drainage cleaning, improvements last longer. Next is the Solid Waste Management Program, guided by Republic Act 9003, or the Ecological Solid Waste Management Act of 2000. This law aims to institutionalize waste reduction at the source and promote segregation, recycling, and composting to minimize pollution. Its core objectives are to reduce, reuse, and recycle waste. These three R's not only protect the environment, but also promote economic opportunities like recycling livelihoods or compost production. This program also encourages community participation, reminding us that cleanliness is a shared responsibility. Waste management involves three main features: waste segregation. This is separating biodegradable, recyclable, and residual waste right at the household level. Then we have recovery facilities, establishing materials recovery facilities or MRFs in barangays where collected recyclables are sorted and reused. Then there is monitoring and maintenance. This is regular community cleanup drives and environmental monitoring that ensures sustainability. These initiatives are not just compliance requirement. They protect the health of the community by preventing breeding sites for flies, mosquitoes, rats, and other vectors. The Clean Air Program is anchored on Republic Act 8749, which is the Philippine Clean Air Act of 1999. Its core goal is to maintain healthy air quality by controlling emissions from vehicles, factories, and other sources of air pollution. This law supports the creation of a pollution free environment through proper emission standards, public education, and enforcement measures. It also emphasizes key actions such as promoting clean fuel use, conducting tree planting activities, and implementing emission testing programs to ensure compliance. Why does clean air matter so much to our health? Air pollution has been linked to asthma, COPD, or chronic obstructive pulmonary diseases, and cardiovascular diseases. These conditions are common in urbanized and industrial areas of the country. As community health nurses, we play an important role in promoting awareness about indoor and outdoor air quality, like discouraging charcoal use in poorly ventilated kitchens or supporting car free days. Additionally, smoke free policies at home, in schools, and in workplaces contribute to cleaner, healthier air and reduce exposure to secondhand smoke. Next is the Tobacco Control Program, guided by Republic Act 9211 or the Tobacco Regulation Act, and align with the World Health Organization Framework Convention on Tobacco Control or FCTC. Its primary aim is to reduce tobacco use and exposure to secondhand smoke. Tobacco use remains one of the most preventable causes of disease in the Philippines. The program's key components include establishing smoke free zones, implementing tax policies that discourage cigarette use, and providing smoking cessation support. The connection between tobacco and environmental health is often overlooked. First, cigarette smoke pollutes the air and harms not only the smokers but also those exposed to secondhand smoke. Second, improper cigarette disposal, such as throwing butts on the ground, adds to solid waste and environmental pollution. And third, we nurses take the lead in health education and advocacy, serving as role models who encourage communities to live tobacco free. Now, what is the connection of all these four programs? When WASH and solid waste management are implemented together, we achieve cleaner communities, free from contaminated water and uncollected garbage. When clean air and tobacco control programs work hand in hand, we create a healthier respiratory environment for everyone. Together, these programs form a comprehensive framework that addresses sanitation, pollution, and lifestyle risks, three of the biggest environmental determinants of health in the Philippines. What does all of this mean for us community health nurses? We serve multiple roles. As health educators, we teach families and communities about hygiene, waste segregation, and maintaining smoke free homes. As advocates, we support the implementation of environmental laws and community based programs. And as collaborators, we work with LGUs, the DOH, and NGOs to sustain these initiatives and monitor their impact on population health. One of the challenges of these programs are the infrastructure gaps, especially in rural areas where water systems, toilets, or waste facilities are lacking. There are awareness issues also, as some communities may not fully understand the link between the environment and their health. However, these challenges also bring opportunities for collaboration. By strengthening partnerships among government agencies, schools, NGOs, and health professionals, we can expand environmental education and create a lasting change. To summarize, environmental health programs aim to create safe and sustainable environments for everyone. The four pillars: WASH, solid waste management, the clean air program, and the tobacco control program each address a vital aspect of health protection. And we nurses play a central role in implementing, monitoring, and sustaining these programs in our communities. By protecting the environment, we protect life itself.